well, thank you guys for joining us for another Health Truth Life video here. Today we're going to be going over matrix concept number 7, which is under intake over here. We're going over environment. So environment, we could go a lot of different ways with it because, really the people, places, and things that you surround yourself with are your environment. But for today, we're going to try to focus on like the physical, your home, office, place you spend a lot of your time, physical environment. That obviously impacts your physical health in a lot of ways.
Yeah, exactly. So, and certainly in there, you did see that there is a social component as far as like where you work, and people you surround yourself is certainly part of your environment. I think it plays a big role in your emotional state, but also your physical state. But this, a big part of what we don't often recognize, I think patients don't often recognize, is the air they breathe, the quality of the air they breathe, the water they drink, and the quality of the water they drink, the things that they put on their skin, because the skin is the largest organ in the body. All those play such a huge role, right, in what we're exposed to. And so this is to kind of tease out that, again, it's not, this is such a big issue and topic. You can go so many different ways with the water, what's in the water and why it's in the water, what's in the air and why it's in the air, and of course what there is in the chemicals that we can put in our skin, whether they're cosmetics or sunscreens or things like that. So that's kind of, it's the thought process of everything that we're putting on our body and or exposed to will it play a role potentially in our physical health.
I think there's no doubt about it. So let's just start with some of the common ones. You mentioned obviously air quality in our homes. It's amazing to me if you miss a month or two on your air filters, and we've all done it, so don't act like you haven't done it. If you miss a couple months and you check that thing, even longer sometimes.
That's me.
It amazes me how much debris and just crap is on there. And if you think about that, that's what we're breathing in. And
like if you've got pets, dogs, cats, of course it even is more like what you're exposed to. But that's just one example as far as things go. I was at a friend's house probably 3 weeks ago on a Saturday. Crystal and I went over to a friend's house, and I noticed that, hey, it was a nice cool Saturday, and they had their front windows open, their back slider wide open, and they had like just nice fresh air coming through. And I said, man, we don't do that often. It's actually the past few weeks, so I have been doing it. But open up the windows and open up the doors, the sliders, and with the screen, and it's been nice, to have that. And so, and one thing that we've been doing with patients who come down with, say, various types of infections, we want them to have good fresh air, because if you're rebreathing stale viral air or stuff that's not good for you, you've got all this infected stuff, gosh, if you're rebreathing, it's probably slightly increasing the load of what you got. So breathe it out and breathe in this fresh air. So going for walks, getting outside, all that can be a part of it. But especially within the air quality of your home, certainly I believe HEPA filters can be very beneficial. Reducing as much as possible carpet, and that's something that's hard to do, but carpet certainly can hold on and harbor things, and they can be allergic to people. So if you're not vacuuming enough and you've got carpet with lots of dander and or dust that's gathering, that can be an issue, and so that's a hard thing to do, because you want to get to the least toxic as possible as far as flooring, which can be something to tease through.
Personally, I've noticed a big difference. We had carpet in a living room, and actually in one of our bedrooms, our son's bedroom, and we recently got rid of the carpet in our son's bedroom, and then not too long ago we got rid of it out of the living room, and it's made a big difference, and it is so much easier to clean and take care of. And so we
what did you put down?
So there's tile in one, and then one we just stained the concrete. Just a smooth surface. It's easy to see when there's a bunch of hair and stuff, dog hair and all that when you need to clean it. So
and ceramic tile is certainly one of your I guess safest. I guess they say watch out for how the adhesive that you use, and also the grout is potentially off gassing and stuff. But there's resources out there to look for the least toxic, most natural. There's plenty of resources out there to look at. But it's just to start this discussion is to start the process of people thinking everything they breathe, everything they drink, everything they put on their skin, that physical component of the environment is affecting your body.
We talk about this a lot, and you already went into it a little bit, just being mindful of how much time you're indoors and making that effort to get outside and get fresh air.
Okay.
I mean, there are some days where I think people don't realize if they get caught up at work and they work a 10, 12-hour day, rush home, try to get things done at the house, homework, whatever with the kids, and they're inside doing that, and they're exhausted. Next thing you know, they're eating dinner, getting ready for bed, and they've spent zero time outdoors getting fresh air.
That's great.
So just, try to be mindful of that and get outside. If it's going for a 30-minute to an hour walk after dinner, or wake up a little bit earlier and go outside, watch the sunrise, and go for a walk and just breathe that fresh air in. It's
absolutely
so valuable, so important.
Absolutely. Yeah. So then, kind of going on to next would be hydration and water. So we talked about hydration with the food and hydration component of what we take in, but the quality of water that we take in, obviously when you think of like third world countries, their water supply is why there's so much disease. They've got infected water supply, and their wells are oftentimes at the same level in their soil as their sewage. And so you can see how obviously it's such a blessing to have sterile water and water that is clean for us. And so, but you've got to put stuff in the water to help clean the water and clean out the bad bugs, and that includes things like chloride, which helps clean out things. But the point is, drinking too much of the cleaner that's in there can be negative as well. So like you go, okay, well, I'm fixing and taking out the bacteria and our parasites, but I've got potentially the secondary effect of these other things. And that plays a role also with fluoride. Fluoride has a benefit, right, to teeth and teeth decay. There's evidence of it supporting teeth structure and such. But too much fluoride is not something you want either. So it's like you're trying to find that balance is challenging. So my encouragement though is have a water, evaluation of your water, and or get a whole house water filter. We're actually considering that, or shopping for it right now, to have our whole house, lined in with a water filter that'll affect shower water as well as drinking water. Right now we have a Berkey for our drinking water, but we have a fluoride filter on that, so we have a limited fluoride exposure. You want some fluoride, and the evidence shows that topical fluoride is oftentimes very beneficial, or can be beneficial, but swallowed and ingested, too much of it may not be great for you. So that's where, again, finding that balance. So consider water filtration, and recognize that, hey, what are people mostly drinking water out of these days?
True. Plastics.
Right. So now we've got BPA-free plastics, right? So then my question, and anyone else's question if they're thinking, is what's the next BPA? Because we know BPA is harmful. It's been found in softer plastics from years ago. But what are the plastics that are now that we don't know about, that in 10 years I want to say, hey, we want XYZ plastic is not in there, but it was in there in 2023, so like you just kind of wonder about that. So obviously stainless steel without a plastic liner and or glass would be your safest as far as water bottles. And again, this is not to say, hey, you got to do this, but just start thinking how much we're exposed to every single day from plastics and from chemicals.
Make a little bit of effort. You're right. That can make a difference. Just getting a filter, like you're saying, doesn't have to be the whole house thing. I mean, that's awesome. If you can do it, go for it. But right now we have a simple, small, similar to a Berkey type thing that we put in the fridge. We pour it in the top. It filters through. And that's where our whole family goes and gets fresh water from.
Gotcha.
We had them come out one time to do the test, and it is amazing if you watch that. And I know they're trying to sell you this, but like just how much is in our water, like straight from the tap.
And you think about, unfortunately, this area that we live in, the Escambia County, Santa Rosa County. God bless the people that work for the water company, but we struggle with our water here. So it's something to recognize that, hey, there's higher rates of cancers oftentimes associated with worse water. Not saying it's all causative, but it all plays a role, right? So you got to be careful with that and recognize that, hey, again, air, water, toxins, man, that's what leads to potentially, some of these diseases. So.
That I wasn't going to bring it up since, I didn't want to, air quality too, though. Like, we're pretty bad air quality. We always rank really low for air
Which you
quality.
wouldn't think, like, right?
We're so close to the water. I know.
know.
I was going to ask you about that, but maybe it is further inland, Pensacola and all that, and
I don't know.
you know,
Yeah.
maybe it is. Obviously, you feel like that's why it's important to get out and get closer to the water and get that fresh, salty air. You know, breathe it in.
Yeah, it's a good question.
Something like that.
So for sure.
And then, you know, next, you brought this up already, but what sort of toxins do you expose the largest organ of your body to, which is your skin? You know,
Right.
what are we putting on our skin? You
Yeah.
know, if it's sunscreen, makeup, lotions, whatever it might be, you have to think about, you know, what's in that. Like, and that's obviously your body's going to absorb some of those chemicals.
Absolutely. So, I mean, one of the biggest things that you see, and it's kind of a thing to recognize, is that what do you see at the beach oftentimes with parents with kids?
Yeah.
The kid has their shirt taken off, a hat taken off, and the mom or dad is slathering, you know, sunscreen all over the child within a minute of being at the beach.
And then again an hour later, and then again an hour later.
So then two things, an observation. Hey, it's, her intent is great, or
Right.
his intent is great.
Right.
But the point is, though, wow, you're going to lower that kid's vitamin D3 level because they're not going to get exposure to sun's rays to allow them to have a natural vitamin D conversion the skin provides. But also you're potentially putting and exposing endocrine disrupting chemicals potentially, and or other chemicals that may have a slightly increased risk of cancer on these kids. And so try to be as natural as possible, right? So I think sunscreen's very nuanced because obviously you don't want to get skin cancer, right? So points out, nothing's
balance,
perfect.
Like, finding the balance.
So probably the naturalist way of avoiding sun is get some sun for 20 minutes with a light tint, no burn for a child or an adult, and then put on some clothes, either a shirt, sun shirt, a hat, you know, something like that. And if you use sunscreen, use it in a smaller amount, but avoid those chemicals in there that may have issues with hormone disruption. There's plenty of resources out there online that kind of discuss, you know, some of those chemicals.
More natural sunscreens you can use that don't
Absolutely. So there's some mineral-based sunscreens which can be more beneficial and or less caustic. And then there's actually, I've heard recently of some tallow-based sunscreens that can be beneficial. Lots of different, you know, things. And of course, your mileage may vary with respect to what works. There's also evidence out there that consuming and eating more seed oils can be associated with a higher propensity of sunburn. So actually your diet can be related to your propensity and or predisposition to higher rates of sun burns. So it kind of shows how it all ties together, right? But cosmetics as well, like women with cosmetics, putting stuff on their skin, and showers, as you got to recognize that all the water that we put in our body gets, you know, absorbed. So even if you have a water filter at home, but you're taking showers, when you're taking a warm shower, your follicles kind of get, you know, dilated, and you can then absorb the water and whatever's in there. So
another benefit to cold showers.
That's a good point. You're right. Yeah, there is I mean, one thing I didn't put in the environment, which of course you brought up, which is great, is cold environment. So we do live in a very sterile, most people like to have a comfortable 72 degree existence, right? Where you're like always kind of right at this even keel point where it's not too hot, not too cold. But cold therapy can be beneficial. It's a part of your environment. So cold exposure and or even hot exposure, including sauna and or sweating, leads to detoxification. But cold therapy, there's evidence that it actually improves neurochemistry, stimulation, dopamine, epinephrine, as well as providing thermogenesis. So brown fat and other fat actually can be more metabolically active under episodes of cold therapy. So, and that's typically thought to be between 40 and 60 degrees, like cold water therapy. But that's a whole nother topic of discussion. But
All right, so another one we have on here is, are you exposed to a large amounts of hormone disruptors? And I kind of wanted to go into that just to explain, what are the main hormone disruptors that are out there?
Man, I think plastics have to be considered as one of the big ones, right? And then other things that are potentially out there that can be an issue are herbicides and fungicides and things like that, are the chemicals that are used to kill bugs.
So how are we mainly exposed to those?
Maybe through water, potentially through air, through foods. And so again, nothing is perfect. We're probably even, if you try to eat organic and stay as clean as possible, you're still going to have some exposure to that which is out there, because we live in an environment that has the blessings of chemicals that can allow for crops to grow and not get killed, and so we have that balance of provision plus I guess having enough to feed a population, right? Yeah. So that's kind of the way industrial farming requires a lot of chemicals, and so that makes it challenging, right?
Yeah.
So
I've heard recently too that a lot of our produce is looking a lot more appealing, but there's a lot less actual nutrient and natural minerals in there. It's lost a lot of that because of some of the things you're talking about, so what are some good ways to how do you go about trying to find what's best for you?
Certainly think for food, organic as possible. Okay. It's certainly important. It's expensive. You have things and considerations of the, those which are more susceptible to pesticides would be those things that you eat the skin. So an apple, you'd want to get them organic. Strawberries, you'd want to get them organic. Bananas, maybe not, avocados, maybe not. So things that you're not eating the actual skin of, you can consider potentially getting non-organic if you're trying to budget, right? Okay. Yeah. That's a consideration. But I think avoiding plastics as much as possible. I think that exposure is big. I certainly believe that clean water is important. We talked about hormone disruption, and one of the comments in here that I mentioned is that you're seeing fertility plummet in over the past 100 years, both sperm count and testosterone production.
That really did stand out to me.
In men.
Yeah, the average man's sperm count in the last 4 decades has declined over 50%.
So what's causing that, right? It's not genetics. Mutations don't do that. Like, this is environmental exposure and or diet and or stress, probably a little bit of everything, right? But certainly the hormonal exposure of the hormone disrupting chemicals has to be considered, and then also got in there discussion of EMF and electromagnetic radiation and frequency. Those are things to be considered, because there's definitely evidence out there that the exposure of cell phones to testicles and sperm, for example, actually lowers motility. There's evidence to show that. It's like, and some of this is nuance where it's like, okay, well, it's like ex vivo literature. In other words, they take sperm and put them in test tubes outside of the body, and they put it next to a cell phone, and they look at it. But I've seen articles and read articles on these things that show that, hey, it likely does likely does have an effect in the body if you're seeing it in a test tube. And so the point is, like, do we know for sure it's causing the greater than 50% lowering of the sperm count? No, but it's a part of it, right? So it's all together. We got to consider getting back to as natural as possible because of what's happening. Yeah.
So then, specifically with that, how would you reduce your exposure? Like, what's the best way to
what?
Phone, any kind of radiation.
I wouldn't put a phone in your pocket, and this is because I have boys, right? So it's kind of interesting. When both my boys play football, last year there was a kid that'll remain nameless, but would put his phone right in his crotch, right where his parts are, like literally right inside, like right in the center, and you're like, dude, what are you doing? And so, but the point is though, these boys are putting them in their pockets anyway, which is right next to your testicles. So I'd say avoid the phones in your pockets. I think it's one thing. And I'd use, speakerphone whenever you're talking, or, things that just get the radiation machine away from your body. There's also evidence, obviously, with phones on airplane mode, you're not connecting to the tower, so your EMF goes way down. The amount of radiation that you're being exposed to the phone goes way down. So that's something to consider as well. That, hey, if kids are still going to put it in their pocket or be exposed to it, put it on airplane mode when you're not using it, and that's an ideal thing for sure. But just reduce it as much as possible, right? Yeah. We have one patient that he's an outstanding patient. He doesn't even have internet in his house, doesn't have a router because he doesn't want his family exposed to the EMF. And is there a chance that that's causing a long-term problem? I don't know, but I think getting it back to as natural as possible is probably reasonable.
Yeah.
Because we're in a science experiment right now.
That's what I was going to
with
say.
these phones and with the EMF.
Yeah, we're at a point where this is all new. We don't know
It's all
what's. Yeah, this is causing.
In the thousands or millions of years of human history,
Right.
this is brand new.
In like 10 or 20 years, they're obviously going to say, wow, like look at some of these things that we did and the negative implications of
Exactly.
those. You know? So
It's all the environment, right?
Yeah.
So
be mindful of that.
Mm-hmm.
I think, go ahead and start to wind it down here, but a couple ending points we have is breathe fresh air. Make sure to take the time to go outdoors and breathe the freshest air you can breathe. We talked about if after a long day of work, like if you rush home and just go back inside and you're breathing more recycled air. So make that effort to breathe fresh air. Drink as clean a water as possible as you can. If you get the filter at home, I guess we didn't really talk about.
Shoot for a water bottle too. I think as natural of a water bottle as possible, right?
Yeah.
To get away from the plastics
Stainless
as much
steel
as possible.
The best,
Stainless steel and glass, and there's some others as well. Of course, some people say that with the stainless steel, make sure it's not lined with plastic.
Right.
Again, it's hard to get away from a lot of these plastics, unfortunately.
And a lot of them have like plastic straws or plastic mouth, pieces.
Right. Yeah. So, but of course, the plastic bottles that you drink out of that are real flimsy, those have softer plastics and there's evidence that they leach more into the water. Okay. So it's like that's a consideration to have harder plastics, and of course BPA free plastic, because we know that BPA is not helpful and actually can be harmful.
So that's what you're talking about. Work to avoid plastic exposure, and then be conscious of the chemicals placed on your skin. And then, how can you reduce your exposure to a physically or emotionally toxic environment?
Something we didn't talk about was the emotional toxic environments that we can place ourselves in, whether it's work, whether it's relationships that are toxic, that we're being neglected in or what have you. Right. These are things that are important, you know?
And we'll get into that. That's kind of why we're holding off, because we will get into that under the relationships on our matrix here. So
absolutely. So any final thoughts or?
Get outside again. Get outside, get the fresh air, go for a walk. There's so many health benefits to getting outside, not just for less exposure to these harmful things, but like the vitamin D. Do it with your spouse or significant other, your kids. Like take some time to walk and talk, unplug and get out, So I think that's good.
And as we're thinking about all this stuff again with environment and just with, all these things with respect to the physical, get back to as natural as possible, and you'll see that's truly where I believe our bodies work best. And so, does that make sense?
Yeah, I don't know if this ties into it, but the barefoot connection with getting outdoors and connecting, walking in the sand barefoot, or just getting outside barefoot. There's something to that, and that's environment to me. That's related, Like
absolutely.
We talked about that the other day.
Yeah, no joke. And certainly does provide a calming, and almost like a centering, as far as things go, for sure. So, but thank you guys very much for listening. We appreciate it. And we'll be back next week with a few more videos. And thank you. And please like and subscribe. And we appreciate y'all, and have a great weekend.
Thank you very much.
All right.